Good afternoon. I'm Dr. Jessica Callio with Southern California Health Institute. I'm here today to talk to our founder, Boris Prilutsky. He founded SOCHi in 1994, formerly known as IPPT, and he has been practicing medical rehabilitative massage as well as sports massage for over 44 years. He's going to share a little bit about his experiences today. For sports pre and post event, for visceral ailments like hypertension, we have protocols for all of this. We have protocols for obviously pain and rehab for injuries. Tell me a little bit about this recent work that you've been doing using an old technique that you learned many years ago in concussion treatment. It's very exciting.
It is more than exciting. Look, I'm in practicing 44 years. And I was post-concussion rehabilitation protocol. I was trained in 1973. It was mandatory. But in Soviet Union, former Soviet Union, we didn't have so many cars. And there is groups used to work. I used to work more performances improvement and rehabilitation from already, skeletal muscular injuries, sport-related injuries. This is what fast, rehabilitate, bring to the function, and these Olympians go to practice back. Concussions, it's not a lot of contact sport guys, and this is how this was developed. It was developed accidentally. No one today in America, if you will check, what to do if one get concussion? Answer, rest in time. Lay, rest in time, and diagnosis very poor. A diagnosis of concussions, best symptoms, what is your name if you're confused. But this is not a reality, by the way. A lot of asymptomatic concussions, yeah? Most of my practice is post-events, sports massage, pre-event, and medical rehabilitative massage, lower back disorders, sciatic nerve neuralgia, thoracic outlet syndrome. I don't remember when the last time, I believe in Soviet Union, I did concussions, but I remember well. It's interesting what happened 3 years and a half. I was sitting in cafeteria in medical centers with a few doctors. We discussed the hypertension. I helped them a little bit. They're developing medication in cases when uncontrollable inflammation, hypertension. When you give these pills and this doesn't work. It's a vertebral artery syndrome. It's also, full article on my website where you can find details and even techniques what to do. And suddenly, meant to happen in front of, was hanging from above the TV and breaking news. And of course, attack on the NFL commissioner. Domestic violence have to be stopped at NFL, and all screaming. And the security camera show video, Ray Rice, this fellow hitting into the face his fiancée at this time. She, of course, knocking her out. They're very strong, these football players. And then he, lifeless body grabbing like this and pulling out its emotions. You immediately negative, woo, how can you do it? Yeah, and here is this kid coming. I'm sorry, man. To me, he's a kid. And I enough around to see he's not violent, Paris. You can see on face of person. And he started apologizing, and he said that he voluntarily submitting himself to anger management. And in the end of this interview, this TV statement, he put like this head down, and he said, I even don't remember how this happened. And I said, wait a minute, something wrong, I said to guys. This is something wrong. It smells like post-concussion psychiatric behavioral disorders. It's known encephalopathy, brain dysfunction. And I immediately, I'm not good to surgery. I have a partner, and I text to him, Ray Rice, find out when he got his last concussions. Sure enough, he 6 months prior to this incident, one after other. It's terrible. This is job-related. Look, NFL is not fair to him. They banned him forever not to play. Just like example, he's sick and he got injured. And that's what I said, no, it's not. And I come back to 1973 protocol that I learned, and doctors ask, don't tell that you know what to do. I said, absolutely. It's most simple protocol and most effective protocol. Bottom line, I'm claiming with good feeling and certainty that I'm the only one, meantime, in America, I know Denver protocol, how to address and how to prevent this brain dysfunction. It's very easy. I don't know if I have time, I can explain. It's easy. Yeah? Do you want me to? Okay. Actually, immediately after brain trauma, concussion, what happened, brain need more blood. The spatial system that's secreting cerebrospinal fluid increasing, start pumping a lot of. But drainage not adequate because immediately it's called reflex spasm in neck to prevent motion, to prevent re-injury. Now this accumulation of excessive amount of cerebrospinal fluid creating intracranial pressure and decreasing blood supply. Here is a situation that we need much more blood supply and this pressure decreasing. What happened? Some group of neurons, they fall into hibernation. It's called hypometabolism. They sacrificing themselves to consume very little blood supply, mainly oxygen and glucose, to allow to other cells to survive. It's surviving. It's not about function. Of course, they confuse. Brain cannot work normally. People after fresh concussions very confused. It's this part of brain, these neurons that go to hibernation, they dysfunction. But what is the problem? That yes, if somebody will rest, will feel a little bit better. But if not to increase cerebral circulation, not to increase blood supply, these neurons that went to hibernation never will come. The main reason why they go to hibernation because of not enough blood, not adequate blood supply, not enough for all cells. What massage therapy doing? This is most simple. We're increasing immediately. We're draining it. Special techniques Dembo proposed to drain cerebrospinal fluid, to accelerate immediately. It's increasing blood supply, and you see, look, I'm since I was kind of inspired again to come back. I'm working with a lot of doctors referring, more than 70 cases, very successful. And the point is that immediately after first treatment, people feeling a little bit better because you're decreasing this intracranial pressure. Very safe, very easy to perform protocol. I'm very exciting. I never thought that in the end of my career, God willing, I will practice many years. I love it. I passionately love it. Yeah, I'm coming back. I will teach this year. I'm planning to teach a lot other. We need to. There is also a program how to prevent concussions. Professor Dembo also proposed how to prevent these concussions. By the way, again, I am inviting you to my website and scroll to the blogs. There is articles, more than 100 articles on different subjects. But at my blogs, I'm introducing, and also a case of Ray Rice. It's absolutely not fair what happened to this person. Absolutely not fair. I feel for him. He just a victim of these concussions, one after other. You can read details. There is published article where I'm explaining scientific parts. Yeah, it's fascinating. I'm right now like I'm starting my practice from the beginning. I love it. It's fascinating. Massage therapy is so powerful.